this crop standard size menstrual cup. Now how exactly it works, it's got a round top. Obviously it's not going to get in like that, so you're going to have to fold it. So you just create a little depression there, fold it up into a little C shape, and of course there are other techniques in which you can create a shape like this. You just want to make it smaller and more nifty, and then what you do is that you're now ready to get this cup into the vagina. So let's say you've got your vagina here. I'm just going to show it to you like this here. You just insert it into the vagina like this, and you advance it all the way to the top like this, and then you release your fingers. You take your fingers out, and what happens to the cup? It kind of opens on the inside, and what you're left with on the outside is a little stem. Now this little stem is, it's made of silicone, and it's not harsh, it's soft, it's rounded, it's not gonna pinch on the outside of your vulva. So let's talk about what's on the inside. So on the inside you have the cup. It's like a little receptacle, and what it does is that it collects blood. So the blood then drops from your uterus down to your cervix and drip, drip, drip into this cup here, and it coagulates in the cup. And that's essentially how a menstrual cup works. Using it, whether it's safe and sanitary, surely it is. Now, we have to first understand that a menstrual cup is made of medical grade silicone. So, and it's also non-porous. So I'd like to do a comparison here. Think about pads and think about tampons. These two items, they are porous. So meaning they absorb stuff. They absorb liquid, they absorb the blood. Anything that's porous allows the opportunity for bacteria to seep in. Now with a cup like this, it's non-porous, so nothing's gonna seep into this material here. So it is extremely safe to use, and if you're talking about infection rates, very, very low. Your infection rates with these sort of things are very low. Does it injure your vagina with having the cup in for very long? No, it doesn't. And you can use these cups safely in your vagina for up to 8 to 10 hours without having to change them. Now this is pure luxury when you're able to do that. Most definitely not. There is no way you're going to lose a menstrual cup once it's in your vagina. How I think about it is I approach a vagina like as if it's a vault. In fact, it is actually called a vaginal vault. There is only one way in, and there is only one way out. The same way you go in is going to be the same way you come out. Then we have girls who ask us, no, wait a minute, I know there's a cervix right at the end of that vaginal tunnel. And yes, I agree with you, there is a cervix at the end of the vaginal tunnel, but you need to understand how small the hole on the cervix is. I'm going to show you a model here, okay? So take a look at this model here. That's your wide vagina. Ample space there. Now this is your cervix. Your cervix is like a little donut, right, up here. And it's got a little hole in the middle there. Look at the size of the hole and compare it to the vagina. You can do the math, right? It's significantly smaller compared to the vagina. Now let's take a look at a Freedom Cup. That's a Freedom Cup. Your Freedom Cup's gonna sit here. How is that Freedom Cup going to fit into that hole in your cervix? There's no way it can travel up there and get up into your uterus. That is just not going to happen. So your menstrual cup is not going to get lost in your vagina. It's just going to stay in the vagina. It's not going to move anywhere else. Now, can it get stuck? So that was the other portion of your question. It is impossible for it to get stuck. It can feel difficult initially in the first few times that you're trying to use a cup because perhaps the technique is not yet perfected. But if you're going to try, it's got suction, isn't it? And if you're going to try and pull on something that has already been in there and it's staying in place because of suction, you're going to have to work it intelligently. You're going to have to break the seal or break that suction. So just go ahead and bend the silicone like that and poof. You create some space, and it allows you to then slowly glide your cup out. So don't fight your cup, approach it intelligently, brain versus brawn. So just break the seal and then release the cup. We have many girls, very young girls, age 15, they've never had penetrative sex. And they ask us this: can I use a menstrual cup if I am a virgin? Question is, you may be a virgin based on the fact that you've never had penetrative sex, But if you do masturbate, so for example, girls who they do a little bit of finger penetration, it might be easier for them to use a menstrual cup because they've experienced insertion with a finger or maybe insertion with a tampon. So of course, with girls who've tried these things, we would encourage them to perhaps switch over to a menstrual cup, maybe a menstrual cup like Freedom Cups, and it would be easy for them to progress on to try and use these. Now, a lot of people have this opinion that, oh, if I am a virgin, it would mean that my hymen is intact. Now, I hate to break this news, but cherry popping doesn't exist, okay? So the hymen is absolutely a myth. Most of the time, as we run through daily activities, by the time we hit our teens, whether it be running, whether it be horse riding, whether it be stretching, doing the splits, your hymen tears away. It's like a little fiber, like a little thin piece of fabric that eventually tears away, and what you're left with is just remnants. And these remnants just somehow create the protection and covers up the opening to our vagina, just pretty much like what our lips does to our mouth. You have it shut with the lips, but it's openable and something can then enter it. So yes, virgins or women who've never experienced penetration, maybe with a penis, can definitely still insert a menstrual cup. Okay, so will using a cup cause infections? No, it will not. It will not cause you to have a urinary tract infection. It will not cause you to have a vaginal infection. Now, a lot of it is based down to hygiene, how you look after a cup, correct? So just like how you wear pads or tampons, you change them regularly so you don't have something soaked and soiled there in contact with your vulva all the time. Now, with a menstrual cup, and this here is a Freedom Cup, so what you're meant to do with these sort of things is that before you use it, you can always put them in some hot water so that it gets that sterile feel for a bit, and then you're ready to use it for your entire menstrual cycle. You don't need to keep boiling it or putting it in hot water in between your cycle. But once you're done with one cycle, what I would commonly suggest is get it soaked in some hot water or get it boiled so that it stays clean and more sterile in that sense. These things will not cause you to have infections, so no. You're not at increased risk of getting urinary tract infections or vaginal infections. Just look after your cup properly and change them in due time. You know, every 10 hours maybe change and empty your cup and boil them in between cycles in some hot water. Surely you can. I mean, peeing is usually not a problem, right? You just go ahead and pee because the motion of peeing doesn't require a lot of pressure. The motion of pooing, on the other hand, sometimes require you to bear down. And I speak from personal experience here, okay? I just like to share with you this little anecdote. Now, I wear tampons previously, prior to wearing cups. Now, with a tampon that sits in your vagina here like this, there's a little string that dangles out, right? And often when you're trying to poo, and because a tampon is porous, it absorbs blood, it becomes a little bit more fluid. It's able to move out easily. So when you're bearing down, particularly when you do have a hard poo to evacuate, you're pushing down quite hard, then your tampon can glide out, and you're worried about, as my poo comes out, does it then touch the string? Now, if you compare a menstrual cup, there's no string that's dangling out from your vagina. It's just a little stem that sits right at your vulva. It doesn't dangle out. And when you're pushing down, even when you do have quite a hard poo to evacuate, you can't possibly push out that cup because it's got a suction effect on the inside, right? So it's not going to glide out unless you break the seal. So plain simple answer to your question is yes, you can pee with the menstrual cup in. That's a no-brainer. But can you poo with the menstrual cup in? Far more comfortable than having a tampon in. So yes, you can poo with a menstrual cup inside your vagina. Yes, you definitely can use a menstrual cup when you've got an IUD in. Let me show you on the model, okay? So this is a very standard model of a vagina at the bottom there. It's nice and wide there. And then you have your cervix over here. And then right up here is your uterus. This is the home for your IUD. So your IUDs live here, and ta-da, you've got a bit of a string down there. Now, where do your menstrual cups live in relation to all of this? So your menstrual cups are somewhere around here. Okay? Now, let's give you a little bit of perspective. Your vagina is about 10 to 12 centimeters long. The string of the IUD, once the doctors have inserted it, and the IUD is used for contraception, correct? The strings are only about 1 or 2 centimeters long. So you've got ample of room in between that string and the tip of your cup there. Now, girls are worried that if you've got a menstrual cup in there and it's got suction and it's using suction to stay in place, will it then suck the IUD out as you're pulling on the cup? Well, you're not supposed to be pulling on the cup anyway, right? When you release it, or when you try to remove it, you're supposed to be breaking that seal and then allowing it to glide out. So don't push down so hard or pull down so hard on your cup. Break the seal first. Anyways, that kind of suction pressure is not going to pull your IUD out. It takes quite a lot of pressure to actually pull this device out. So it's very safe for you to use your IUD and your cup together. Now, girls do ask me as well, now if I'm new to the IUD, can I still use the cup? Well, if you've just had your IUD inserted, number one, you want to know whether your body's adjusted to it. You're going to be worried about, is my IUD still going to stay in place? So just give it about a month, because if IUDs are inserted, it's in the first 30 days of its insertion, the IUDs can play up. Perhaps it moves around, perhaps it wants to come down a little bit lower or move up a little bit higher. So give it that first 30 days for your IUD to settle down in its new home, and then you can go ahead in your next menstrual cycle to use your cups safely. So yes, you can use your menstrual cups or your freedom cups together with your IUDs. It's not going to suck it out, it's not going to pull it out. Maybe I'll start with just explaining what vaginismus is. So vaginismus is a condition that some girls experience where they have a huge element of fear and anxiety when it comes to any sort of penetration of the vagina. They get an extreme profound amount of pain, or they're very, very sensitized. So they preempt the pain sometimes even before the penetration happens. So inserting a menstrual cup is essentially a penetration, isn't it? So my recommendation in any woman who has vaginismus is to first see a doctor who actually manages vaginismus and get that settled and sorted first, because you don't want to associate the use of a menstrual cup with anxiety or fear, because the process will not be comfortable and likable by you, and you will instead start to dislike that process. And we don't want you using freedom cups or menstrual cups and associating that with a negative feeling. So get over the vaginismus first, and there means the ways of doing it, seeing a sexual medicine doctor like myself, or seeing a physiotherapist, or there are sexologists who deal with vaginismus. Get a good grasp of it, get over it first, then become comfortable with using the menstrual cups. I wouldn't be a hero and jump straight up to menstrual cups first in the event of vaginismus, but get comfortable with the idea of something inserting into the vagina, even with a small dilator. Start with that first, small successes, and then if you get to a point where you go, I think I'm ready mentally, try the menstrual cups. Action.
You're right. You okay? Yes.
Is your anus through which the poo comes through. Now, I forgot the question. Sorry.